Today's video is tailored for males experiencing premature ejaculation. We'll focus on Lejam, a medication designed to address this issue. In this video, we'll discuss what is Lejam, how to use it, its potential side effects, and some useful tips at end of video for managing premature ejaculation. Premature ejaculation occurs when a man ejaculates sooner, usually within 1 to 3 minutes of penetration. For some men, it can be temporary and can get better on its own, but for others, prescribed medicines can be helpful. Lejam contains Dapoxetine, which is a selective serotonin reuptake inhibitor and helps to extending the time to ejaculate, enhancing control over ejaculation. Now let's discuss how to use this medication. Lejam is available in 2 strengths: 30 mg, which is low dose, and 60 mg, which is high dose. Typically, the starting dose is 30 mg, but your doctor may recommend a higher dose. Take 1 tablet 1 to 3 hours before sexual activity. Swallow the tablet whole, with at least 1 full glass of water to avoid a bitter taste. This medication can be taken with or without food. Do not take more than 1 tablet in a day. Possible side effects for Lejam may include dizziness, headaches, and nausea. In addition to medication, here are some lifestyle tips to help manage premature ejaculation. Engage in regular exercise, specifically pelvic exercises including Kegel. Consume a balanced diet, rich in vitamins and lean protein. Minimize stress levels. Ensure an adequate amount of sleep. Quit smoking. Maintain a healthy weight. By incorporating these strategies, individuals may find relief from premature ejaculation and enjoy improved sexual well-being. If you have any question or suggestion, just drop below, we will answer that.